Hey guys, Dr. Ruth Roberts here. Hope you're doing well and enjoying this March day. It's kind of back to crazy weather for everybody. So rained like crazy last night, which was awesome because it knocked the south snow, which is yellow, and not because a dog urinated on it, but because of all the pollen dropping. Anyway, dropped the pollen down into the puddles, which helps all of the folks living here with allergies feel a little bit better today. And dogs too. We see dogs coughing and sneezing and having the same symptoms that people do during the pollen season. So if that's where you're living in the south, you may start to see your dogs sneezing more, cats sneezing more, a little coughing, and sometimes itchy skin too. So be mindful of that. One of the things that's been helpful for pets in the past is actually wiping their feet when they come in from outside, and then also wiping down the entire body with the damp rag once a day or twice a day to help knock the pollen off. So the thing we don't think about is that, yes, they're inhaling it as they walk around and run through the grass and things of that nature, but then they come inside, they've got this pollen all over their bodies, and then they groom themselves, so they're actually ingesting a terrific amount of pollen. And so recently we've started to make the connection that GI trouble tends to go up during this time of year simply because they're ingesting a lot of pollen. So if you find that's an issue for your pet as well, then again, try the idea of wiping them down at least once a day with a damp washcloth or something of that nature, and then wiping their feet off every time they come in, and see if that doesn't help some of those symptoms. Hope the rest of the country is enjoying a little bit more warm weather than last time we talked. I think you guys got dumped pretty good for, thankfully, not too rough of a winter for you, but at any rate, that's where we are. But that's not why you're here. There's a couple of things I want to talk about. One is Janet wrote in, and she is having a heck of a time getting her Yorkie housebroken, and I'm not sure if the Yorkie is a puppy or an adult dog or what have you. For whatever reason, these toy breeds are notoriously difficult to housebreak, and sometimes people just give up and live with pee pads sort of for the rest of the dog's life. But there's a couple of things you want to work on as you're working on housebreaking a pet, whether it's a puppy or an adult dog that came out of a situation where it just never kind of figured that stuff out. One is when it's just like for kids. If you're gonna get potty training going, you want to make sure that they are focusing on the task at hand. So you want to set up a schedule, so something like 15 to 30 minutes after they eat, and then several times during the day, where when you go outside, you take them on a leash so that you control the situation and help focus them on the business at hand, instead of running through the yard and playing and things of that nature. So go outside, walk around the yard, go to the spots that you think they like the most as far as a bathroom break, and kind of hang out there. If nothing happens in 2 to 3 minutes, come back inside. If you're using a crate for crate training, into the crate for about 5 or 10 minutes. If you're not, then just keep the leash on, keep a hold of the other end of the leash, even to the point of tying it to yourself. And essentially what you're doing is creating a setup so that if the dog starts circling or sniffing as if it needs to go to the potty, then you go right outside. You've still got the leash on the dog. You go right outside, and then you can set it up so that the dog gets rewarded for positive behavior. So right outside, dog goes potty, and great, good job, all of that. If that doesn't happen, keep using that leash or umbilical method to keep the dog focused on going outside to go potty, and also not allowing it to kind of cruise the house on its own and then go potty somewhere you don't want it to. So that's been very helpful. Make other times to go outside to go play. So you want to separate playtime from business time, so to speak, so that you can help focus that dog and let it know what times are appropriate to go outside, and hopefully keep them focused enough so they actually go to the bathroom, complete the deal, and then come back inside for a few minutes, and then go back outside to play, if that makes any sense. A lot of times we make the mistake of running outside and playing and all of that. The puppy never, or the dog never, goes to the bathroom and then comes back inside and goes potty. So you want to keep them on task, so to speak. So I hope that's helpful, Janet. Crate training, there's a lot of folks that don't like it because it's essentially a cage for a dog. But if you frame it in the idea that it's the dog's personal space, it's a great tool. So they are generally not going to mess up their own bed. So that's been extremely helpful for a lot of situations. And if the dog is a little bit anxious, it's a great place where many dogs will actually end up putting themselves in timeout so they can kind of calm down, let those feelings of anxiety drop, and then come back and interact with the rest of the household. So hopefully those are all useful. I think we've talked about that in the past. So if you scroll through some of the other videos, you'll probably find some additional answers there. There was a link I put up from the ASPCA about how to crate train your dog without making it a battle, so that your dog begins to accept that crate as a good place to go. So hopefully that helps you guys, Janet, but really it's all about setting the dog up so it doesn't have an opportunity to make a mistake. So that should help you there. The other question Aaron wrote in about is, and Aaron, I hope you're able to join us today, and that my phone may actually show me questions today. For some reason it wasn't last week. But Aaron was writing in about vaccines, and in specific Leptospirosis vaccine. So she lives in LA, and evidently there's been an outbreak of leptospirosis there and in many other areas. So the fascinating thing about leptospirosis is that it is a killed bacteria vaccine. And what that means in terms of duration of immunity is that really it doesn't have a duration of immunity more than about 12 to 15 months. So in plain English, that means that from the time your dog was vaccinated, and they serial blood tests and things of that nature, at somewhere you're going to see titer levels, or in some studies they actually challenge the dog with a live or active bacteria to see if they get the disease. So at some point in time, that duration of immunity, or the ability of the vaccine to protect the dog from that disease, starts to wane off. And so roughly a year after it's received the vaccine, that duration of immunity is pretty close to gone. I've heard Dr. Schultz talk about leptospirosis vaccines, and to be really effective in endemic areas, he actually recommends giving them every 6 months. But these are places where, such as Texas and the Gulf states and things of that nature, where the problem is much bigger of an issue. And generally the dogs that are affected are going to be the ones that are out hunting and in the environment. However, because leptospirosis is a waterborne bacteria, and it's often simple for any animal or person to pick up from standing water, we've started to see it in more of the small breed dogs. And here's the difficulty. There are multiple Serovars, meaning subtypes or species of bacteria, leptospirosis bacteria, that are out there and that can be tested for. However, there's only 3 or 4 of them that actually cause disease. So, for instance, on a typical leptospirosis test panel, you'll see leptospirosis, icterhemorrhagiae, cryptophocosis, and then Anopheles and Bratislavia and several others. The interesting thing is that almost every dog will test positive for Anopheles and Bratislava, and so yes, they're positive for leptospirosis. However, those Serovars, or species of bacteria, don't actually cause disease. But many veterinarians will, say, okay, your dog has lepto, and so we should vaccinate it forever and ever, amen. If you look at the different types of leptospirosis vaccines that are available, Many of the combination vaccines, meaning that the leptospirosis is mixed in with distemper or parvovirus, don't include the Serovars that are actually out there making pets sick. And there's some discussion that there's currently a 4-way leptospirosis vaccine, which is just the active Serovars of leptospirosis in the vaccine, but there's some discussion that those Serovars are actually not the ones causing disease currently. So it's kind of a tough situation that leptospirosis vaccines traditionally have been the ones that cause the most autoimmune reactions or vaccine reactions. And then typically they do not lead to autoimmune disease the way that some of the modified live viruses such as distemper and parvo have the potential to do. But the vaccine itself can make the puppy sick or the dog sick. The good news is that the vaccines have been adjusted so that many of the components have been taken out, so there's much less of an issue with it. So, having said all of that, it gets really difficult to advise clients what to do about lepto. When an animal or a person gets leptospirosis, it's a horrible disease. It affects the GI tract, so often you'll see it can affect the liver, and it can affect kidney function. And so it's a bad disease, and it is potentially preventable by vaccination. So it's a real catch-22, unfortunately. Aaron's particular problem is that a lot of the boarding kennels in LA are requiring updated leptospirosis vaccines and are not okay with titers. And that's, as I explained earlier, that's part of why the titer really is not effective, that protection is going to wear off. Additionally, there's some cross-reaction with the vaccine and the test, so that you may get a positive for a dog that's been protected by the vaccine. Conversely, you can get a positive on the test for a dog that's been sick, and that blood value doesn't necessarily mean that that pet is still protected against the disease with leptospirosis. So that's the other kind of tough thing. But that, Aaron, is why they're asking you to vaccinate and not get a titer done on vaccinations. So it's a tough call. The vaccine manufacturers want us to vaccinate every dog because the disease stinks when you get it. The incidence rates are still low enough in my area that I can't really recommend doing it. But I think overall, what you need to do is have a conversation with your veterinarian about, what's the actual risk for my pet to develop leptospirosis. And, ultimately, it's odd that boarding kennels end up dictating your pet's medical needs or medical vaccinations, but in many cases they do. I mean, we just, if you need daycare, you need daycare, and, if that's the only way it's going to happen, then that's going to be the only way it happens. So I'd advise you to look for other daycare settings, talk with your veterinarian about your pet in specific. If you find that, yes, the risk really is fairly high in this area for right now, and remember, next year, 2 years, 3 years, that leptospirosis risk may be way, way, way down, especially as the water kind of flows. I think out in California, you guys finally got out of your flood, or got out of your drought situation and went straight into flooding and mudslides and all sorts of crazy stuff. So you've got a lot more water running around right now than you've had probably in a decade. So as things start to dry out again, it may be that next year this time leptospirosis is not such a risk. However, having said all of that, if you find you do actually need to vaccinate your pet, I would strongly encourage you to use Thuja afterwards, or Thuja is spelled Thuja, and it's used homeopathically to treat lots of detoxification. I routinely use it after vaccines as a mother tincture to help protect the pet against any adverse reactions, and in particular with rabies virus, as that has been associated with low thyroid function and both long-term and short-term issues as far as other autoimmune diseases. So using Thuja, we've seen very, very minimal short-term reactions, and then my belief is that we have prevented long-term reactions from being such an issue as well. So that Thuja is found all over the place. There's a herbal pharmacy company that makes a nice brand, and then Wise Woman Herbals also makes a nice tincture as well. And the dose I've been using is a drop per 10 pounds of body weight twice a day for 5 days, and that seems to really minimize any reactions. Homeopathically, doctors will use a single large dose, immediately large in terms of homeopathic strength, immediately following vaccine, like literally as quick as I pull the needle out, down into the mouth, these homeopathic tablets go for dissolving and being absorbed through the mucous membranes. So regardless of kind of what you find, I definitely look for Thuja to help you guys out as far as preventing vaccine reactions and things of that nature. So that's what I know for today. I see some folks out there, for whatever reason my phone is not even telling me who you are, and you may be asking questions as well, and I apologize. I just can't get this thing to play right, so time to go visit Apple and see if they can fix this thing up. As far as vaccines in general goes, there's a lot of discussion about, do we need vaccines? Can we use homeopathic versions of them? Really, what should we do about that? And do we need vaccines to be given every year, every 3 years? What's the story? So I'll start first with rabies, because that's the one that has some issues going on. One is that it is legally required for a 3-year, either a 1-year or 3-year vaccine to be given as it is licensed. So even though many of the 1-year vaccines are the same thing that's in the bottle that says it has a 3-year license, if your veterinarian has given your pet a 1-year vaccine, your veterinarian may only give you a certificate for 1 year. If they give you a 3-year vaccine, then they can give you a license for 3 years. The Rabies Compendium changed this year, and part of that is in recognition that there are certain health issues for pets that are exacerbated by vaccination. For instance, cancer, autoimmune disease, things of that nature, and recognizing that there is more titering being done. So there's a rabies challenge study going on, and its goal was to show a 7-year duration of immunity of the rabies vaccine. Dr. Schultz has been doing most of the research on vaccines for decades, and it's his opinion that if you show a 7-year duration of immunity, likely that pet is protected for life. Now, I'll speak to that a little bit more in a couple of minutes. But unfortunately, what he found when he got to year 4 is that he began to see titers drop down below protective in about 20% of the pets in the study. And then at 5 years, even more, so roughly 30 to 40% drop down to titers that were not considered protective. So what he was able to determine is that there is cell-mediated immunity. And what that means is that it's the sort of baseline defense mechanism and some memory, immunity memory, that allowed the pet to continue to be protected against rabies. And the question is that truly protective when the pet is challenged with live virus? And unfortunately, we still don't have an answer to that question. So the way to test that is to do a challenge study in a USDA lab, because they're the ones that are authorized to work with rabies vaccine virus because it is so virulent and nasty. When they did the challenge study for the pets that showed low titers but had cell-mediated immunity, that none of the animals that had been vaccinated, Gracie just came over to say hey to us. Anyway, none of the animals that had been vaccinated got sick or contracted the disease, but only something like, I think the USDA requires that 88% of the animals that are considered the control or unvaccinated group get sick with with the rabies virus. And in this situation, it was something like only 86% did. So it's a study that's no longer valid, unfortunately. So Dr. Schultz is trying to get some more time in a USDA facility to re-challenge these pets that show cell-mediated immunity but low titers to see if they are actually protected against rabies virus or not protected. So that's sort of ongoing. If you don't know about that, it's a study that is totally self-funded by the researchers and by donations from private individuals. So go check out the Rabies Challenge Fund. I'll put a link to that down below. But Dr. Schultz and Dr. Dodds have been, making that connection, particularly between rabies virus and vaccines and autoimmune disease. And in Dr. Dodd's case, she feels that it is strongly involved in the big increase in autoimmune thyroiditis in dogs. So the immune system attacking the thyroid gland and producing or causing low thyroid function. So that's kind of been a bear. The other thing that's kind of interesting about titers in rabies is that because of this change in the compendium, they are actually starting to accept titers not as proof of vaccination, but as sort of a buy for year 4 or year 5, if you will, particularly for animals that have a medical reason not to have a vaccine given to them. So there's some progress there. I think what they found too is that 20 years ago, if your dog was bitten by a rabid animal and it was considered unprotected, it was a horrible thing. It was either euthanized and tested for rabies, or the better case scenario was a 6-month quarantine, which was still pretty awful because it meant that the dog was completely separated from its family. And that was very stressful and that kind of stuff. What they finally realized is that none of those dogs ever got sick. And what changed in the Rabies Compendium is that if a dog or a cat has ever been vaccinated and it bites a person, it is still considered protected. So they will ask you to revaccinate, the health departments that is, or potentially can work something out with you on an individual basis to have your pet titered for rabies virus, and if the titer is still high, then perhaps accept that as proof of vaccination or proof of protection is a better way to put that. So I hope that makes sense. I think I'm starting to run short of time here, so what I'll do is talk a little bit more about the other vaccines and what's considered to be necessary and not necessary and all that good stuff, and let you guys get a bit more information. The one thing I did want to say is that finally, after a year, I'm holding in my hands our multivitamin supplement, which I'm really delighted, and that's probably backwards, so let me just turn this around and see if that makes any more sense. But we've got the 2 or 3 more pallets coming in today and tomorrow, the small dog size and then the cat size. And I've told you over the last several weeks, I'm so excited about this supplement because it's a way for you to get a balanced multivitamin with glandular support that you don't have to go see a doctor to get. My dogs and cats actually were just enjoying the heck out of it this morning on their food, and the box that we brought back from our warehouse is been thoroughly inspected by everybody. I guess they can still smell all the good stuff in there. So look for that popping up on the website. We'll be having some really great specials about it. If you caught a glimpse of the label, and I'll do this one more time, see if you can spot the spelling error. And if you catch it on the catch the spelling error and note it down in the comments section below, I will send you a free bottle. So just set it down in there. Tell me what you see, if you saw the spelling error, and we'll go from there. So the awesome thing is that I had 4 professional people proofread this label, and my wife Mary Jo catches it on the label when she's looking at it in her hot little hands. So that's what I know. Hope you guys are having a great day, and we'll talk again next week. Thanks.